I think I first heard about the society around 1990. I was at SPR, which is where pretty much all fellows and faculty at UCSF would actually present their stuff. And ran into Tim Garson, who was one of my mentors, actually. I spent a few months training with him in 1989. And he said, "Are you going to NASP?" And I had no idea what he was talking about, and so I sort of figured out what NASP was. And then he said, and also, you know, we have this group that actually meets, usually at the American Heart Association meeting. So I really heard about it from Tim Garson for the first time. My first meeting, I remember it very clearly. It was about 25 people in a room, mainly drinking beer and socializing. But I remember that from the very beginning, really the meeting was focused on sharing ideas about multi-center clinical projects. Back then, there were always 4 to 5 projects that were ongoing, and the idea was that anybody could basically show at the meeting and pose a question or present an idea. And I remember it was Frank Fish who was actually talking about flecainide and the recognition that there were actually some babies who were having dangerous and fatal arrhythmias due to flecainide. And that was really new information. And he proposed the concept of let's all pool our information and our data and write a paper about this. And a year later, Frank's flecainide paper came out. And I remember Tim Garson basically saying, this is a completely free society. Anybody can say anything. Just come, join, just stand up and say whatever you wanted to say. It was always very informal from that point of view. And then I've sort of watched it develop really over the last 25 years into what it is now, which is much more formal, much better organized, much more serious society, and it's actually been great. I got into pediatric cardiology as a 4th-year medical student. It was not on my radar screen at all. And what happened was, to tell you the truth, was that I was at the University of Connecticut. My wife-to-be got into medical school at Case Western. So we thought that we could spend at least a year together. So we figured that was a good excuse to get married. So we got married and moved to Cleveland. And I did my entire 4th year in Cleveland. And I ended up doing 2 months of pediatric cardiology with Jerry Liebman at Case Western Reserve University. And Jerry, of course, was an electrocardiologist. He was into body surface mapping, but what he really loved was electrocardiograms. He loved to argue about electrocardiograms. He was, pretty rigid about how he actually, read electrocardiograms. But he forced me to read about 250 vectorcardiograms as a 4th-year medical student, which is pretty amazing. That really set the tone, and eventually went into cardiology after several years doing general pediatrics. To pay back the National Health Service, actually, is how I got through medical school. And when I did my training in San Francisco, I sort of thought that meant that I really couldn't go into electrophysiology, because I'd always admired electrophysiology. They always seemed to be the smartest guy in the room. And I went to UCSF, which actually didn't have an electrophysiologist. And they, in fact, believed they didn't need an electrophysiologist because they just didn't really see the point. And so I went there to train thinking that I probably wouldn't be able to be an EP person. But then sort of got the bug and figured out how to get myself trained, which was basically with the adult group there with Mel Scheinman. Well, I've told many people, doing a catheter ablation for me is like heroin. In fact, I've been doing it now for 25 years, but in my current role, which is, division director, I still get to go to the laboratory, and I do have junior partners that I work with very, very closely and help them out and give them, advice from time to time, which I don't really need. But still, for me, just holding the catheter and getting it to that spot and ablating the pathway is, in fact, the thing. I really think electrophysiology is an amazing field. This is what I tell fellows. When I'm interviewing fellow candidates or when I'm advising fellows in our program, they want to know, what my perspective is. And my perspective is that, clearly EP is the best subspecialty of cardiology. We know this. We know this because if you sort of think about it, we get to both diagnose stuff and we get to cure it. There's no other part of pediatric cardiology that gets to do both of those things. I mean, the cath guys, they're almost never surprised. I mean, they're there to do something, but they never get to sort of logically sort things out. The concept about EP is sometimes there's a single beat in the entire EP study that allows you to make the diagnosis. And once you've seen that single beat, whatever it is, you then logically go to put the catheter at the right place and you cure the patient. There's no other part of cardiology that allows us to do that. So that's what I like about it. When you look at the Heart Rhythm Society, it's sort of easy to get the impression that it's a whole bunch of adult electrophysiologists doing AFib ablations. And it's very easy from a pediatrician's point of view to sort of feel a little sort of alienated or disoriented. If you actually drill down and see what Heart Rhythm Society is, it's tremendously diverse. In fact, this morning's plenary session was all about our diversity. And the diversity, it allows us to sort of learn from each other and teach each other. And, you know, the pediatricians within HRS are full-fledged members, and they're tremendously appreciated for their contributions. If you sort of think about the history, many of us trained with adult colleagues. You know, I did my training with Mel Scheinman and the group at UCSF. Many other, you know, people of my generation, in fact, trained with adult electrophysiologists. And still, many pediatric electrophysiologists have a tight relationship with their local adult, you know, program. And that's great. I mean, there's a huge amount of cross-fertilization that actually occurs. That partnership between us as individuals is really important for us taking care of our patients. Particularly now, I mean, we're living in the genomic era, and a lot of people forget, but, you know, children all have parents, and many adults have their own kids, and the idea that we can take care of a patient and not take care of the entire family is, of course, becoming completely false. So we are all in this together. As far as the relationship between the two societies, you know, I think that PACES has got a spectacular reputation within the Heart Rhythm Society. The reputation comes from being consistently effective, well organized, delivering on what they say they're gonna do, having an incredibly professional and collegial relationship with people. I mean, pediatricians are popular. You know, we're nice people. Okay, so that's the first thing that actually helps. But I think PACES has actually done an excellent job and has done a good job of you know, representing the interests of children and patients with congenital heart disease within the Heart Rhythm Society. The issue for us is to try to find a way for these two societies to actually work in partnership rather than in competition. And so one of the exciting things that actually has happened, and which we hope to implement over the next year or two, is to really make that partnership real and to sort of figure out the ways in which PACES can actually participate in you know, some of the higher level discussions that actually happen in the Heart Rhythm Society. Part of the deal of being the president of the Heart Rhythm Society is my major role is to, as we say, implement the strategic plan. So it's really not about me. It's not about my year as president. You know, my job is really to take the overarching goals of the Heart Rhythm Society and, you know, and move them forward. Having said that, I would say that you know, I have the perspective of being a member of, you know, sort of a minority segment of the Heart Rhythm Society. And so, you know, I, as well as anybody, recognize the ways in which the diversity of the society is its strength, and I would like to find substantive, you know, concrete ways of, you know, both calling that out and operationalizing those things. And so, you know, in terms of the segments of the society that often feel, you know, somewhat disconnected from the main discussions that go on in the society, would be the basic scientists, you know, the allied professionals, you know, pediatricians, and you know, we're looking for ways of bringing all those people in. They all have representation on all the governing bodies. There's no doubt about it. But in terms of the, you know, identifying those communities and helping those communities actually develop their own independent voice within the society, that's one of my goals. In that way, frankly, what PACES is up to is being seen as a model for Heart Rhythm Society. And for me, personally, that's incredibly exciting. I'm incredibly proud to represent PACES within HRS.